From this video, we are going to see the routes of administration of the drugs. The route used to give a drug depends on three main factors: the part of the body being treated, the way the drug works within the body, the formula of the drug. So these are the three important factors that have to be considered while selecting the routes of administration of a drug. Then only we can get a good therapeutic effect of a specific drug. And the routes of administration of drug is broadly divided into 5 important categories: topical, oral, parenteral, rectal and inhalation. Topical means application of a drug to a localized area of the body or to the surface of the body part regardless of the location of the effect. Topical administration also includes transdermal application, where the substance is administered onto the skin but is absorbed into the body to attain systemic distribution. And the topical administration of drug also includes enteral administration of medications that are poorly absorbable by the gastrointestinal tract. And now let us see the oral and rectal administration of drugs. What is meant by a oral intake? Oral administration. Administration through the gastrointestinal tract is sometimes termed as enteral or enteric administration. And enteral enteric administration includes both oral and rectal and also sublingual administration of drugs into the body. The rectal route is an effective route of administration for many medications, especially those used at the end of life. So the rectal route of administration is a very powerful route of administration of a drug in order to save the life of a patient at the end of his life. Next comes the parenteral administration. Needle insertion angles for 4 types of parenteral administration of medicines, that is intramuscular, subcutaneous, intravenous and intradermal injection. The parenteral route is any route that is not enteral. Parenteral administration can be performed by injection using a needle, usually a hypodermic needle, and a syringe, or by the insertion of an indwelling catheter. Now we can see the locations of application of parenteral administration. So what are all the locations in which the parenteral administration of a drug has to be done? Central nervous system, epicutaneous, that is application onto the skin, extra-amniotic administration, that is between the endometrium in the case of pregnancy, and nasal administration, it can be done through the nose, and intra-arterial, that is administration of drug into arteries, and into the heart, that is called as intracardiac administration, and into the skin itself, that is called as intradermal. And intramuscular administration is nothing but administration of drug directly into the muscles, and intraocular is administration of drug into the eyes directly, and intraperitoneal is nothing but in case of peritoneal dialysis, through which the drug has to be administered through peritoneum. And intravenous, that is administration of drug into the vein directly. Next comes the nasal inhalation. Inhalation by smoking a substance is likely the most rapid way to deliver drug to the brain. So when you administer the drug through nasal inhalation route, a drug can be delivered at the maximum rapid speed, and it will reach the brain within a very short period of time, and the individual can get the effect immediately. So this is a very advisable mode of administration of the drug. The severity of dependence on psychoactive drug tends to increase with more rapid drug delivery. And this is a table showing the different routes of administration of drug as a summary. And in the first column, the various routes are given, and in the second column, the explanation for the individual routes are given. For example, in buccal route, that is held inside the cheek. Enteral route is delivered directly into the stomach or intestine, and inhalable, that is breathed in through a tube or mask. Infused route is nothing but injected into a vein with an IV line, and intramuscular injected directly into the muscle with a syringe. Intrathecal injected into your spine, that is spinal cord. And intravenous administration of drug into the vein or into an IV line. Nasal given into the nose by spray or pump. Ophthalmic route given into the eyes by drops or gel or ointment. Oral administration is nothing but swallowed by mouth as a tablet or capsule or lozenge or liquid. Otic administration is drug given by drops into the ear. A rectal route is inserted into the rectum directly. Subcutaneous is injection of a drug just under the skin. Sublingual is keeping a medicine under the tongue. Topical is application of a drug to the skin. Transdermal is given through a patch placed on the skin. So these are the different routes of administration of drugs. So thank you very much for your patient hearing.